everyone. My name is Ashley Brooks, and I am here to present a presentation on bariatric surgery clients and the importance of social work and therapy for them. Again, my name is Ashley Brooks. I'm currently a certified social worker in Kentucky. I am currently under supervision, earning my hours so that I can sit for my LCSW, or essentially my clinical license in Kentucky. I know it's different everywhere else, but I'm currently earning my hours and preparing for the test in the near future. This topic is very near and dear to me because I myself am a bariatric patient. I had the gastric sleeve procedure January 10th, 2024. So my year is coming up pretty soon. It's definitely been a journey, so I can really say that I connect very well with this subject, and it's been a journey for me personally, but also professionally, essentially seeing and experiencing surgery and being within the system with supports and things of that nature. I currently do also provide individual therapy. I'm hoping to, get involved with perhaps doing individual therapy for bariatric patients soon. Currently, I do provide therapy for adults with a history of substance use and extensive trauma. I also currently work in some of the local hospitals in Kentucky as a medical social worker. I essentially work more so with our psychiatric units within these hospitals and help determine level of care, if they're able to come to my hospital or if they may need something more of a level that maybe we can't provide, but being able to also help them figure out alternative placement, whether they need something that's higher level or lower level. My interests include, again, medical social work, bariatric patients, and also the biopsychosocial implications of racism and discrimination on Black children from conception to adulthood. I also am pretty invested in that topic as well. That was something I studied very heavily within my graduate program. So I'll hopefully be creating something else for that topic very soon. So here are a bit of obesity facts for basically for our U.S. population. As we know, obesity is something that is prevalent in just about every country. In the U.S., the adult obesity rate has increased from 13.4% in 1962 to 42.4% in 2018, which is a 200% increase. That is a staggering, frightening fact. And we can also just kind of think about how the U.S. has changed within that time, looking at the types of food that are available, inflation and the prices of, healthier foods versus, going out to get something to eat. Even just the rustle and bustle of how fast and quick most of our days go now. A lot of us don't necessarily have the time to, sit down and, make a healthy meal. And, if I have a 30-minute lunch, I'm probably going to run down to the closest place I can find to me and grab something to eat, right? So also just kind of looking at some of the societal environmental changes that have occurred in that time period as well. Obesity currently affects more than 108 million adults aged 20 years or older in the United States. And, with the above mentioned statistic, there is concern that, is it continuously increasing? What is contributing to this? Research has shown that they believe it's, economics. They believe it's, societal factors, even cultural factors as well. There is also economic impact to treating medical conditions associated with obesity that has also shown to have increased over the years. It's been demonstrated that patients with obesity compared to patients who do not suffer from obesity experience increases in annual healthcare costs of 36% and medication costs of 77%. So, there are people who are obese who, suffer from things like diabetes, high cholesterol, and and some of those people as well can be, low income and things like that. So even thinking about, what type of foods and what type of access do some of these people have? And are they, eating, McDonald's and things like that because they want to, or because that's something I can afford, that's close to me? Or, will food stamps, cover, more of the junk food versus the healthier foods that we see in the supermarkets? And if I'm someone who might be low income, I have children, or maybe I'm even like disabled in some way, I'm on a fixed income, think about how that can also impact their food choices as well. Obesity certainly is a risk factor, and it is the greatest contributor to chronic diseases in the United States currently. Class 3 obesity, which is formerly known as morbid obesity, is a complex chronic disease in which a person has a body mass index, or BMI, of 40 or higher, or a BMI of 35 or higher, and is experiencing obesity-related health conditions. The percentage of patients with a BMI greater than 40 is approximately 9.2%, or 20 million adults aged 20 or older. According to the National Institutes of Health, it is nearly impossible for people with class 3 obesity to sustain weight loss through diet and exercise alone. Essentially, once your body has registered your higher weight as it's normal, right, it continues to try to return to that weight. Bariatric surgery essentially works by changing how your body manages what you eat. So essentially kind of restricting how much you can eat, right? Allowing healthy diet and lifestyle changes to be effective for sustained weight loss and health. So bariatric surgery is a tool essentially in your toolbox, along with try with making those lifestyle changes with your diet, with your physical activity and things of that nature to help you sustain weight loss and health long term is the goal. So this is an overview of bariatric surgery. So the two most common types of bariatric surgery are gastric sleeve or sleeve gastrectomy and gastric bypass. So gastric sleeve, so that is the one that I had. It's typically now completed laparoscopically. So they have, let me see, I think I have about 4 or 5, very small little incisions that I have on various areas on my abdomen. Essentially with this procedure, it's performed by removing about 80% of the stomach. So as you can see, they remove, a great deal of the stomach. They typically will use medical staples to create the new stomach to seal it. And then you're typically going to be left with a stomach pouch that is the size of a banana or a large egg. So the effectiveness on average is that people lose about 60 to 70% of their excess weight. Studies have shown that gastric sleeve surgery led to resolution or improvement of many obesity health related symptoms. So, if you think about like type 2 diabetes, for example, high blood pressure, high cholesterol, even thinking about things like, physical pain, like back pain and joint pain and things like that. Gastric bypass is a bit more invasive. So, gastric bypass essentially involves creating a small pouch from the stomach and connecting the newly created stomach pouch directly to the small intestine. So, they're going to be essentially changing the direction that the food is going. So essentially it bypasses a portion of your stomach. The effectiveness of this one in particular, as far as weight loss, typically people on average will lose about 70% of excess weight within 2 years. After gastric bypass, swallowed food will go into the small pouch and then directly into the small intestine, essentially bypassing most of your stomach and the first section of your small intestine. So a bit more invasive, but typically people will lose a bit more weight from bypass compared to sleeve. Sometimes, depending on how much weight a person will need to lose, a doctor may recommend, sleeve over bypass or bypass over sleeve, depending on what is going on with that patient, how much weight they'll need to lose. Even just thinking about, do they have scar tissue on inside their body due to previous surgeries and things like that. So all of those things are in consideration when you are looking into your surgery. They certainly have disadvantages and advantages of both. I'll kind of stick to the advantages for now. So gastric sleeve is a much simpler surgery. The operating time for sleeve is typically about 40 to 70 minutes. So usually it could maybe be about an hour, just kind of depending on the patient. While gastric bypass, can take usually between 2 and 3 hours to complete. With sleeve, there's also a much lower chance for nutrient or vitamin deficiency compared to the gastric bypass, due to sleeve not having to recreate the way that your food is digested. Therefore, there's fewer chances of complications as well, compared to bypass. But I can say that bypass typically, the patients will lose a bit more weight. So, a lot of folks may go for that one, especially if they may be a bit heavier and it's something that their doctor recommends as being more effective for them compared to sleeve. So there are many myths about gastric surgery. One of them being that weight loss surgery is the easy way out. That is something that I heard myself. And honestly, it kind of discouraged me because, I didn't want to be perceived as lazy, right? I was already obese. I was already, feeling the brunt of stigma of people assuming that I'm lazy, that I eat, slop and I'm not healthy and all of these things, right? Like these are things that people that are obese, hear. So hearing that now this surgery is thought of as an easy way out discouraged me for a bit, and it kind of made me put a pause on my journey initially because although I just got my surgery earlier this year, I actually had been looking into it for years. But once I kind of started hearing people say things to me, it kind of discouraged me, and I, had to take a pause on that. If anyone on here is thinking about it, don't let anyone discourage you. It is absolutely the best decision I have made, and many people that have had bariatric surgery, whether it be sleeve or bypass or one of the other ones, typically don't regret it. So, okay, sorry. Weight loss surgery certainly is not easy. It's a long process, and even with surgery patients, we have to make major changes to our relationships with food as well as engage in lifestyle changes. Some of this may also include, talking about traumas. Some people used food as a coping mechanism, and, that contributed to, their weight gain and a unhealthy relationship with food. So there's a lot of things that make this incredibly hard, including basically changing your entire lifestyle for the most part, right? Obesity is also, after, years of research and things like that, it's not considered just an issue of, someone overeating or eating foods that may not be as healthy and lack of self-control. But it's a complex condition resulting from multiple genetic, biologic, metabolic, behavioral, social, and economic cultural factors. So it is incredibly complex and is not as simple as, just, don't eat chips or don't eat fried foods or, just don't eat as much. It's simply not that simple. One of our other myths I'd like to kind of tackle is, you'll never be able to eat food again. I think that was one of the things I was somewhat scared about at first. So right after surgery, the patients are gonna, have to ease into eating regular food. They're going to start on liquids for a while, then they'll go to soft or pureed food as they continue to recover. Eventually, they'll be able to eat, a variety of normal foods. And granted, one of the things that definitely will change is, the portions. You're not going to be able to eat as much as you used to, right? The main goal of bariatric surgery is to realize and emphasize portion control. Many patients find success with smaller, more frequent meals focusing on protein. That doesn't mean that you can't incorporate foods that you love in moderation as part of a balanced diet, but there's definitely emphasis on balanced diet, high protein, typically low carb, things like that. But you certainly can eat normal foods, but certainly in moderation. It's more dangerous than being obese. That is one of the myths I think I have a lot to say about. For most people, the risks of obesity are much greater than the risks of bariatric surgery. Surgery in general, no matter what surgery it is, there are always going to be risks for, complications, right? One of the things that when I was going through my journey that I did and I talked to my doctors about was, the risk of surgery versus not getting surgery, right? Like, what would that look like for me? And which one weighed out more for me, and that helped me make my decision. Studies report a nearly 90% reduction in premature death from all causes after surgical weight loss, as well as dramatic drops in diseases like, type 2 diabetes, high blood pressure, and heart disease. While every surgery, again, comes with risks, bariatric procedures are among the safest on the operating table. The risk is less than 1 in 1,000, which is about 0.08%, which means that weight loss surgery is as safe or safer than many common surgeries like gallbladder removal. So, while, it is a surgery and there are risks because there's anesthesia and there are things that, maybe we don't plan on happening or know will happen, a surgery is, something that you have to take a risk on, no matter if it is a gallbladder surgery or a weight loss surgery. So you always have to kind of keep those in mind. But according to research, it definitely is not as dangerous as continuing to be obese, due to a lot of the health outcomes that are kind of connected with obesity. Number 4 on our myths list is bariatric surgery is for people who have hundreds of pounds to lose. That's not, particularly true. Essentially, weight loss surgery goes by, typically, especially those who are going through like insurance and things like that, they typically have to meet criteria, especially under insurance. Typically, it's going to be a BMI of 35 or more, coupled with like weight-related health conditions like diabetes, high blood pressure, sleep apnea, things like that, or a BMI over 40. Of course, all of this is going to be different by the state. Some of them have different requirements, but also your BMI is going to vary based on, your height. Obesity and BMIs are, research has shown that there are, certain cultural groups that may have higher BMIs. And for instance, women also typically have higher BMIs than men. So there are so many things that go into, the body mass index. So this is certainly something that is not true. For instance, I didn't have to lose hundreds of pounds, but my BMI was well over 40 because of my height and things, right? So that's not necessarily true. But some people do have to lose hundreds of pounds depending on, how large they are. So that is, not true, but there are certainly people who do get the surgery and, do lose hundreds of pounds. Number 5, most people who have the surgery gain the weight back. That is not true. About 30% of weight loss surgery patients regain much of the weight they lost within 5 years of surgery. So that means that about 70% of patients maintain their weight loss. Most weight loss typically happens within the first 8 to 12 months after surgery, regardless of the patient's lifestyle. So while, after surgery and honestly before surgery, when you're doing some of your pre-assessments and things like that, it's encouraged that, you start to eat high protein, low carb, that you exercise and all of these things. So, and honestly, sometimes people get the surgery and they see the weight coming off and maybe they stop those habits. But, after that, what they call the honeymoon phase, which is typically that first 12 months after the surgery, after the honeymoon phase, weight loss tends to slow down a bit. And sometimes the folks that kind of fell off of some of those healthy habits, they'll see some weight regain. But doctors definitely recommend that patients within that honeymoon phase try to lose as much of the weight that they need to lose as possible within that honeymoon phase, because typically that's going to be the time frame where your body is going to lose the most weight, in a pretty short amount of time. Number 6, it will solve all of my health problems. It certainly will not. Bariatric surgery will not solve all of your health problems. It is a tool that is supposed to help you lose weight and maintain weight loss long term, but it is not an overnight solution. You typically will not see, all of your weight come off, super quickly, overnight, instantly. When patients do follow, the post-op instructions, they can lose their excess weight and improve or eliminate health problems like diabetes, and typically increase their life expectancy by on average about 9.3 years versus a diabetic patient who does not have surgery. So it won't solve all of your health problems. You may still have some of your health problems, but they may not be as severe. But some people who have had surgery have seen some of their health problems like diabetes, go get resolved, and they no longer have diabetes because of the weight loss and the lifestyle changes that they made to their diets and things like that. And number 7, this is one that a lot of obese patients hear as well. You can lose the weight on your own. You don't need surgery. Just change your diet and, go exercise. Don't eat as much. It's not as simple as that. For many people, diets fail on their own, and they're, unfortunately unable to lose enough weight with just diet and exercise alone. Weight loss surgery, especially for those who are using insurance to cover expenses, is typically, a last ditch effort for weight loss. A lot of insurances, especially, they require that you have sometimes 6 months of weight management. So being able to show that you have tried all of these non-surgical solutions before they'll even, approve weight loss. So I had gone through weight loss drugs like Wegovy, like Phentermine. I had trainers. I, faithfully, counted my carbs and my proteins and all of these things, but I could never lose all of the weight that I needed to be at a more healthy weight for my body, right? So it's honestly something that a lot of people, try as a, last ditch effort to try to lose the weight. So it certainly is not that simple, unfortunately, especially if someone has been obese for most of their life, because for their body, that's normal. And because it is kind of a normal for their body, it's so hard for them to try to lose weight and keep it off. So unfortunately, people who, might be obese and they're trying to lose weight on their own, they may lose weight, but it might not be, as much as they want to. And many of them gain it back, unfortunately. Benefits and potential side effects. So there are certainly benefits and potential side effects. Again, these are things that, people have to consider. Some benefits include improvement of health conditions like diabetes, improved mental health, social life, quality of life, increased life expectancy, and of course, weight loss. About 90% of patients lose half of the excess body weight that they need to lose, and keep it off long term. So it definitely can be beneficial. Potential side effects include acid reflux, and long-term acid reflux can actually result in stomach ulcers, which is not great. Malabsorption, malnutrition, because of the changes within their bodies. Sometimes as a result, there can be issues with patients' absorption, getting all of their required nutrients, especially B12, and due to decreased food consumption, there can be potential that patients may not eat enough in general, which can also potentially lead to eating disorders, right? And other problematic eating behaviors. And again, with surgery, sometimes there can be increased levels of stomach acid, which can result in acid reflux and even stomach ulcers if left unchecked. This is why it is crucial that patients adhere to their diets and follow post-operative instructions. So, vitamins and nutrition are things that are very important. And I can say, it's going to be a learning thing for the patient, and, for those around them, and even for, a therapist that might not be familiar with this population in general. But there's a lot of things that go into this, just with learning this new normal. So finally, we're kind of getting into the bulk of what I want to talk about, right? So the role of social work and therapy. Mental health support is crucial in bariatric surgery because it helps patients navigate the psychological challenges associated with weight loss surgery. Social workers and therapists play a vital role by providing pre-surgical evaluations, counseling to manage stress and anxiety, and ongoing support to adapt to the new lifestyle post-surgery, enhancing the overall patient experience and increasing the likelihood of sustained weight loss. Key aspects of mental health support in bariatric surgery include the pre-surgical assessment, which is one of the areas that, social workers and therapy are kind of introduced initially. Healthy coping mechanism development, body image and self-esteem work, lifestyle modification, family and social support, and collaboration with medical team. Addressing the psychological challenges ultimately contributes to better long-term success by addressing the underlying emotional factors tied to weight gain and promoting healthy coping mechanisms. Some of the topics that will be discussed will be the psychological impact of obesity, the role of social work in bariatric surgery, and the role of therapy in bariatric surgery. So we'll start with the psychosocial impact of obesity. One of the things that a lot of patients deal with is body image and self-esteem. So body image is a person's positive and negative emotional attitudes, beliefs, and perceptions of their own body. Excuse me. Some patients experience persistent or worsened body image due to side effects like excess skin, scarring, and tissue. Body image is complex. It relates to what a person believes about their appearance, how they feel about their body, their height, their weight, and shape even. One study examined psychological well-being and body image in a sample of pre-bariatric surgery patients, and in those with 1-year follow-up, showing a body image and psychological well-being in most patients. Dissatisfaction from those patients in that study was often related to excess skin folds. So typically, as a result of surgery, body image, was improved a bit in general. Self-esteem is how a person values and respects themselves. It affects how a person takes care of themselves emotionally, physically, and spiritually. Self-esteem in general is, somewhat weight related as well. It may represent a overlooked and important target throughout the bariatric surgery process that could enhance surgical outcomes. So now, especially with therapy, these are things that people tend to kind of have to talk about, because it's a huge change once you are so used to being treated a certain way by others, or even treating yourself a certain way because of your weight, and then you make such a drastic change to where you've lost weight, you've made all of these changes. It can certainly change your body image and self-esteem, and it can be kind of hard to kind of deal with, right? And I don't think that some people realize how connected weight it can be related to self-esteem and body image. With that being said, body image and self-esteem are also connected to psychological well-being. Some patients experience psychiatric diseases or psychiatric issues such as depression and anxiety due to body image dissatisfaction, which can result in, a lot of things that we'll kind of touch on, like eating disorders. With bariatric surgery, there is potential for eating disorders. Some people may have eating disorders before surgery, right? Some people may develop them after. That is something that can happen. Eating disorders and behaviors before surgery. According to research, eating disorders and problematic eating behaviors are common in those seeking bariatric surgery, possibly because they have engaged in repeated dieting, which is a precursor to disordered eating. Binge eating disorder, or BED, is the most common eating disorder reported in patients seeking bariatric surgery. Some studies suggest that a diagnosis of BED before surgery is associated with eating disorder symptoms after surgery and less weight loss and more weight regain. Existing disorders can significantly impact surgery outcomes. It's likely underreported, as a lot of eating disorders are, right? They may fear that they will not be approved for surgery if they admit to an eating disorder or disordered eating habits. Binge eating is characterized by episodes of eating large amounts of food while feeling out of control. Eating disorders after surgery. One of the things that is seen is loss of control eating. This is believed to be the most defining feature of binge eating. It's common among bariatric patients. About 13 to 61% of patients before surgery, and seen in about 17 to 39% of patients post-surgery. Bariatric surgery patients are instructed to change their eating behaviors after surgery. They are instructed to limit meal size, to chew extensively. They must have, strict schedules, weigh and measure their food. Even some folks will have to do things if they don't, buy things that are already, measured and weighed out individually. And sometimes even avoid certain foods. For example, sometimes like red sauces or spicy things, which are some of my two favorite things ever, give me trouble. So I have to limit my intake of some of those as well. Some of the things that we can see in folks post-surgery are vomiting. Frequent vomiting can cause electrolyte imbalances, which can lead to a cardiac arrhythmia, which can cause sudden death. So it can also cause damage to the esophagus due to the acid. Dumping syndrome. It is not fun. It happened to me once, and it was quite awful. Patients will often complain about lightheadedness and sweating after eating a high glucose meal or consuming a large meal. This can be extremely uncomfortable and accompanied by intense fatigue. And another thing that we can also see at times is grazing or night eating syndrome. It's actually a proposed diagnosis. It's not, something official that you might see in the DSM right now. But it's currently classified as a type of other specified feeding or eating disorder. And essentially it's just kind of, eating to eat. Little bitty bites of things, but you're not particularly hungry. It typically occurs at night, of course, but not so much eating big meals at once, but still eating even though there's no need to, as your body's not particularly hungry. Bulimia and anorexia, believe it or not, they can be seen post-surgery. Rates are not known, but there have been several case studies that report patients who have developed bulimia or anorexia after surgery. Typically, they'll meet all the criteria for anorexia, for example, except for the low weight. Night eating syndrome, again, is characterized by episodes of awake nighttime eating and a disrupted circadian rhythm. It's also been documented in patients after surgery with prevalence rates ranging from 2 to 18%. In general, again, eating disorders are still very unreported, so it's unknown how many people may have already had a disorder prior to surgery. And honestly, eating disorders are less likely to be diagnosed in patients with bigger bodies because there's still this stereotype that bigger people can't have an eating disorder because they're not skinny, right? When that is completely false. It is something that happens. There are people who are bigger, even obese, that have eating disorders. Some other problematic eating behaviors include, of course, vomiting, dumping, and grazing. Again, these are things that occur when, people try to eat more than their stomach allows, or, have a bit of loss of control with eating. Um, Dumping is essentially the failure to digest food. So if you eat too much food too quickly, you can experience dumping syndrome. It is extremely uncomfortable. And oftentimes when someone does, eat too much, they will typically vomit because their body can't take it due to their stomachs being so much smaller. Um, so it is important that people do eat smaller meals. Usually throughout the day helps. Um, Grazing typically will occur in about 47% of patients. And I think it's just something that patients just kind of got used to right before surgery. And, some of these behaviors with food are some of the things that have to be addressed. Otherwise, there will be some issues with being successful after surgery. Depression and anxiety. So the relationship honestly is complex and bidirectional. Obesity and depression and anxiety, affect each other. So that means that obesity can lead to mental health issues, and depression and anxiety or other mental health issues may lead to eating habits that cause obesity. So they have a relationship that can be complex, and for for success after surgery, these are things that a lot of our patients have to talk about, and find ways to cope and things like that in a positive way that don't include food as a coping mechanism. Um, Obesity can lead to mental health issues, including anxiety and depression, due to obesity causing things like increased inflammation. So, excess body fat can release inflammatory chemicals that affect brain function and contribute to depression and anxiety, right? And also hormonal imbalances. Obesity can disrupt hormone levels like leptin and insulin, which are linked to mood regulation. And also reduce self-esteem due to not being satisfied with your body image. And mental health issues like depression and anxiety can contribute to obesity by chain by causing changes in appetite and activities. So, eating more and maybe exercising less, right? When I might be in a depressive state, I might not want to go outside. I might not want to be around anything, but I might be in my kitchen eating, right? I might DoorDash some food because it might make me feel better. And also stress related eating. Sometimes these things occur and we don't even notice because our bodies and minds just react. And we aren't being as mindful about how we feel and what we're doing when we feel, things like stress. Stigma and discrimination. Weight stigma is bias against people based on their body size. It can include discrimination, sizeism, stereotyping, and social exclusion. Weight stigma can have a significant social and emotional impact on people, including psychological. So it can lead to depression, anxiety, low self-esteem, and suicidal thoughts even. Social, rejection by others, including, sometimes family and friends, and weakened social relationships. And due to this, sometimes people may also experience social isolation. Physical, so, increased stress levels, disordered eating patterns, potentially eating disorders, and exercise avoidance. Career, weight stigma can lead to lower pay and fewer promotions, according to research. Being overlooked due to your looks instead of your work ethic and quality, and even healthcare. There is healthcare discrimination. Weight stigma can lead to things that may affect the quality of care you receive. For example, having all of your health problems downplayed and contributed to your weight instead of taking them seriously and doing tests. Instead, your doctor might say losing weight will solve that when how do you know it's just my weight? What if there is something else going on as well? Something that could also be contributing to my weight, right? So, lots of things that weight stigma can affect. Weight bias and stigma can affect how resources are allocated for obesity related research, which can lead to chronic underfunding and also understanding, which can, negatively affect the population due to people really not being educated on the topic. The role of social work in bariatric surgery. So this is a diagram of what a typical bariatric patient care team will look like. You'll have your primary care provider, your mental health professional. I had, of course, the LCSW. We have lots of LCSWs in roles like this, especially within hospitals, in medical facilities and things like that, where I live, which I think is fantastic. Other mental health professionals are fantastic as well, but I do like how social workers also try to, just help patients holistically, as well as, with their mental health challenges. You'll have a social worker, which may kind of, be in that quote unquote role that's, I guess, more traditional, where they're, connecting you to resources. They're usually kind of like a case manager role. You'll have a dietitian, and of course your bariatric surgeon. Your team may include other people, especially if you have any conditions that require like a specialist or anything like that. So you'll certainly, you could certainly see social workers in, like at least two of these roles potentially. So you might have one that will be the therapist that's looking more on the mental health side, and a social worker that's working maybe more so on the, macro meso level, where they're looking at things that, what should we change within the hospital system to help this population? Or are there resources that could help this this patient in particular, get the things they need to be successful and things like that. So having an interdisciplinary team is definitely beneficial for the patient. One of the things that I think, all the social workers know is one of the things that we do focus on is, determinants of health. In some way, shape, or form, we're kind of focusing on addressing those determinants of health. One of the things that we do in roles within bariatric surgery in general is identifying what social determinants of health are that affect a patient, looking at community resources, patient advocacy, care coordination, creating care plans, and discharge planning. Identifying social determinants of health typically involves, the social worker assessing clients' living situations, understanding factors like, food insecurity, their neighborhood safety, access to transportation, and social economic status. For community resources and advocacy, connecting the patient to needed resources in the community, advocating for patient autonomy and rights regarding their health and decisions related to their health. Some of the things that they do, which some of this definitely falls more into the clinical social worker role if you're providing therapy, is addressing barriers. So, helping the client overcome and identify barriers to healthy eating and exercise. So that could be financial constraints, lack of healthy food options, lack of transportation, lack of knowledge about nutrition, or even cultural norms. Counseling and support. So providing, individual counseling related to, body image, self-esteem, stress management, coping skills, all of these things that will, hopefully help with encouraging lifestyle changes, connecting to resources that are needed in the community, and addressing weight stigma, whether it be, something that you do yourself or others around you. Preoperative assessment. So this is something that happens before any surgery occurs. You need to meet with, your physician. So you're meeting with your primary care physician. They typically might refer you. You'll have to meet with the bariatric surgeon, do some tests to see if there's, anything internally that they need to know about. And you'll also need to do things like, get a psychological and behavioral functioning assessment, which is usually where some of the therapists and stuff come in. So it evaluates your physical health, mental state, support systems, and motivation. And this kind of helps us look at things that may be concerns for surgical success. So just trying to kind of get a head start on things that might need to be addressed before surgery, or things that they know will need to be addressed as, we go through the process. For support, it is crucial for patient success. So your nutritional support, so dietitians, you're meeting with a dietitian before your surgery. Vitamins, they're highly recommended, and, adjusting to your new normal. Physical activity is encouraged, building long-term support system, and emotional and psychological support. So that encouragement of using therapy. Body dysmorphia, for example, is something that can occur after surgery. So it essentially is a mental condition causing an intense focus on perceived flaws in appearance. So it can cause you to avoid mirrors, or obsessively look at yourself, avoid pictures, social situations, anxiety about weight or size, need for constant reassurance. It is pretty prevalent. It's been shown in studies to be something that folks experience. Typically, probably about 57% of patients show at least some symptoms of body dysmorphia. Again, it's a tool. Surgery is a tool. You will still have to, work on your mental health, because this is a huge change that affects everything, including how, you may think of yourself and how you adapt. So it is crucial that, exercise, diet, and behavior modification, as well as psychological counseling, are part of the process to sustain long-term weight loss. Support groups are fantastic. So support group attendance after bariatric surgery is associated with greater post-operative weight loss due to, creating a support system of people who have similar problems and needs, having that safe space, combating isolation, accountability even, and encouragement, and sharing knowledge and tips. Social workers who work in this kind of role, where they may create or facilitate or even recommend support groups for patients, are further encouraging and providing holistic support for them. CBT. This is a modality that a lot of us are, probably familiar with. It aims to help people identify and challenge unhelpful thoughts, learn self-help strategies, and change behavior. The goal of this is behavior modification, which is important for this population. It is collaborative, goal-oriented psychotherapy that helps people manage mental and emotional health issues by changing the way they think and behave. It can be effective for bariatric patients with the help of mental and behavioral changes. It can help with mental and emotional well-being by helping reduce symptoms of depression, emotional eating, and anxiety. It can help with behavior modification. Excuse me. So helping them develop healthy coping strategies, maintaining healthy behaviors, and reducing the risk of weight regain, as well as, group therapy. Group CBT can also help patients prepare for surgery, improve adherence to those new lifestyle changes, and even reduce the risk of developing psychiatric concerns. It can be used post and pre-surgery, and can also be combined with other interventions such as mindfulness-based interventions or dialectical behavior therapy. Mindfulness-based therapy, or mindfulness-based stress reduction, MBSR, it is a meditation therapy that was developed by Professor John Kabat-Zinn in the 1970s at University of Massachusetts. It was initially a 8-week course used to treat patients' mental health and chronic pain after they hadn't responded well to traditional therapy. It is led by an instructor who guides participants in weekly practices like meditation and yoga in order to reduce stress levels. It's being used for treating a variety of illnesses such as depression, anxiety, and chronic pain. Common practices are, of course, breathing techniques, gratitude journaling, meditation, yoga. And its goal is to encourage present awareness, being aware that your body is full and how your body feels. What is your body telling you, right? Being aware of how certain food makes you feel versus other foods. It is intended to be completed in like a group setting. However, you can practice a lot of these on your own as well. Its goal is to bring people into the present moment so that they can experience their thoughts and feelings non-judgmentally and avoid worrying about the past or future. Interpersonal therapy, IPT. So this is a short-term therapy intervention that focuses on interpersonal relationships and triggers. It can help with weight loss and reduce compulsive eating in patients with a high BMI. This can be used to focus on things like triggers or relationships that may be triggers for someone who binge eats, for example. Some examples may include like grief, role transitions, and interpersonal turmoil, right? The goal of this is to explore those triggers, interpersonal turmoil, the patient's relationship with food, and its connection to the patient's obesity and eating habits. Family therapy. It can be helpful for bariatric surgery patients and their family in several ways, including lifestyle changes, so engaging in activities and making healthy choices together, mimicking new behaviors to make lifestyle changes a natural part of everyday life, sharing experiences, so creating a better understanding of each other, behavior change, so engaging in positive behavior change can help patients and their families become healthier. Discussing current and or prevent enabling behaviors, discussing family's relationship with food if patient and family are close and may share many of the same habits. The goal with this is to address issues affecting the patient's progress and success as a unit, especially if the family is very close. They have similar eating habits and things of that nature. There are, there's not a ton of research, not as much as I think we would like to see, right, on bariatric patients. Some future research, that I would like to see as as someone who engages in research and as someone who is a bariatric patient, is, looking at more long-term outcomes, assessing the sustainability of weight loss, studying the long-term impact on comorbidities, identifying factors that contribute to weight regain after surgery and developing strategies to prevent it, quality of life, psychological impact, so looking at the mental health outcomes of bariatric surgery, investigating the role of pre-surgical psychological evaluation and post-surgical support in optimizing outcomes. Personalized medicine, so identifying patient characteristics that predict optimal response to different surgical procedures, and then tailoring post-surgical care plans based on individual needs and metabolic profiles. With that, that could make the surgery even more successful for patients if we're able to figure out what will work the best for them based on their characteristics. Internal health research, so studying how bariatric surgery alters gut bacteria and how this impacts metabolic health. And then also exercise and nutrition, optimal exercise regimen for bariatric surgery patients, to maximize weight loss and maintenance, evidence-based dietary guidelines tailored to post-surgical needs, access to care and disparities, what factors are affecting access to bariatric surgery for underserved populations? What are potential disparities in outcomes based on socioeconomic status, ethnicity, and other factors? And the continued innovation of surgical techniques. So, looking at efficacy and safety of newer, minimally invasive bariatric procedures, emerging technologies in weight management, and also, potentially, hopefully, more research on the psychological benefits, the prevalence of eating disorders in the population as well. All right, in conclusion, patients who undergo bariatric surgery are making huge lifestyle changes that can affect them in every way. Social workers play a key role in providing support for patients and their health outcomes. Interdisciplinary teams are needed to provide holistic care and support for patients. Combined expertise ensures a holistic assessment of physical health, mental health, nutritional status, and readiness for lifestyle changes. Collaborative decision making within a interdisciplinary or interprofessional team allows for individualized treatment and surgical planning. The unique perspective of each team member promotes dietary plans, exercise regimens, psychological support, and post-operative care strategies uniquely designed for each patient, optimizing the chances of successful patient outcomes. During the post-operative assessment phase, the interprofessional team can coordinate preoperative testing and consultations and implement strategies to reduce surgical risks. A interdisciplinary team approach improves outcomes following weight loss surgery by facilitating comprehensive patient evaluation, individualized treatment planning, enhanced perioperative management, multidisciplinary support, continuity of care, and patient education. By leveraging multiple healthcare professionals' collective expertise and collaboration, patients can receive comprehensive care and support throughout their weight loss journey, leading to improved outcomes and long-term success. Here are some of my references in case anyone wants to do some further digging. This was a very fun and informative presentation, even for me, because, as I said, I am even continuing to learn even as a bariatric patient myself. I am hoping that we'll in time have, more research and more references to refer to. Thank you very much for being here with me. If you would like, you can click the link on the last page and complete the quiz for CEU credit. Thank you again, and hope to see you soon.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.